Mental health, first aid and suicide. Suicide is the act of intentionally taking one's own life. Suicide behavior includes any actions that indicate someone may be thinking about or planning to take their own life, such as talking about suicide or giving away possessions. Some common signs and symptoms that someone may be considering suicide include talking about feeling hopeless, helpless, or trapped, talking about being a burden to others, withdrawing from social activities or relationships, using alcohol or drugs more frequently, expressing feelings of shame or guilt, talking about feeling trapped or having no way out, changes in mood or behavior, such as anger, agitation, or anxiety, giving away prized possessions or planning for after their death, a sudden unexplained recovery. People do not recover from suicidal ideation overnight. This is a warning sign they may have planned their death date. It's important to note that not everyone who is thinking about suicide will show these signs, and some individuals may hide their feelings and intentions from others. It is possible for a healthy person to become suicidal after a traumatic event such as a bereavement. If someone is showing signs of suicide or suicidal behavior, it's important to take their feelings seriously and to provide support and assistance. Here are some strategies taught in mental health first aid training that can help. Listen with empathy. If someone is talking about feeling hopeless or considering suicide, it's important to listen with empathy and without judgment. Avoid minimizing their feelings or offering overly simplistic solutions. Offer hope and reassurance. Let the person know that they are not alone and that help is available. Reassure them that things can and will get better. Provide resources. Mental health first aid training can provide individuals with information about resources and treatment options that may be available for individuals who are struggling with suicidal thoughts or behavior. This can include information about therapy, support groups, and crisis hotlines. Create a safety plan. If someone is actively considering suicide, it's important to create a plan to ensure their safety. This may include identifying safe places or people to turn to when feeling overwhelmed, and creating a plan for how to handle crises. Seek professional help. If someone is showing signs of suicide or suicide behavior, it's important to encourage them to seek professional help. This can include therapy, medication, or other forms of treatment. Age. In the UK, the highest suicide rates are among individuals aged 45 to 49 for men and 50 to 54 for women, according to the Office for National Statistics. Suicide is the leading cause of death for men under 50 and women under 35. Gender. In the UK, men are 3 times more likely to die by suicide than women, according to the ONS. However, women are more likely to attempt suicide than men. Race and ethnicity. In the UK, suicide rates are highest among individuals who identify as white, British, Irish, according to the Samaritans. However, suicide rates among individuals who identify as Black, Asian, and minority ethnic, also known as people of the global majority, are increasing. Sexual orientation and gender identity. In the UK, individuals who identify as lesbian, gay, or bisexual, LGBT, are at higher risk for suicide than individuals who identify as heterosexual, according to Stonewall. Transgender individuals are also at higher risk for suicide, with 48% of transgender people under 26 in the UK having attempted suicide, according to a 2014 survey by the charity PACE. Socioeconomic status. In the UK, individuals living in areas of higher deprivation have higher suicide rates, according to the ONS. Unemployment, homelessness, and financial difficulties have all been associated with increased risk for suicide. It's important to note that these demographics are just a few examples and that suicide can impact anyone regardless of their age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic status. It's important to approach suicide prevention and mental health with an intersectional and inclusive perspective, recognizing that different individuals may face unique challenges and experiences that contribute to their risk for suicide. Overall, suicide and suicide behavior can be very serious and require immediate attention. Mental health first aid training can provide individuals with the skills and knowledge needed to provide effective support and assistance to someone who may be considering suicide. It can help to prevent suicide by promoting awareness, reducing stigma, and increasing access to resources and treatment. Check us out at Mental Health and Life. We provide suicide first aid, SFA, and applied suicide intervention training, ASIST, to individuals and organizations. Thanks for watching. Like, share and subscribe. Check out Mental Health and Life for all your training needs.